The Eastern Cape Health Department says at least 6 facilities in the province have been significantly damaged by disruptive winds there. The province experienced strong winds and heavy rains following a level 5 warning from the South African Weather Service. The provincial department says the roof at some hospitals was blown off, while others were left without water due to destroyed infrastructure. Let's get you a sense of how bad it's looking. Bring in the Deputy Director General of the Eastern Cape Health Department, that's Dr. Mtandeki Xamlashe, who joins us now via our video link. Doc, it's great to have you on the program. Thanks so much indeed for making time, albeit under these circumstances. As a start, help us understand how bad it's looking. Where are your main concerns this Monday morning?
Thank you for having me. Most of the aspects you've mentioned, about 6 facilities have been damaged, but our main concern is around Xamlashe Hospital, that is in Chris Hani District Municipality, which coincidentally our Honorable Premier is visiting this morning at 8:30. That's where the roof of a maternity and a pediatric ward was ripped off by the gale force winds, and we had to relocate patients to All Saints District Hospital and Frontier Regional Hospital in Enoch and Kichima. They are both within the same district, so there's not much inconvenience to relatives who will be visiting their loved ones. But we are grateful that no one was really injured, in all this that happened over the weekend.
Yeah. How many patients were affected by the stuff?
Plus minus 80 patients in terms of beds availability that are affected, but we have enough capacity within the precinct and proximity to absorb that capacity. So we will be using our patient transport vehicles for patients who need admission to be moved to the nearby facilities. But our infrastructure unit has responded very fast. It is on site as we speak right now to assess the damage and to make sure that there is proper planning.
Yeah, speaking about that planning, we know that typically in these institutions, you need to plan ahead when it comes to the kind of elective surgeries that you need to carry out. How much of that has now been affected?
Elective surgery for us is not really a big problem because we can plan around it. We're more concerned about emergency surgery.
Yeah.
The Newzroom Hospital is just less than an hour's drive to Frontier Regional Hospital. So most of the patients, especially your maternity patients, and will be moved to Xamlashe Hospital, to Frontier Hospital, which is not far from Xamlashe. So we have our EMS teams that are going to be right at Xamlashe Hospital on site to make sure they can actually take patients quickly to the nearby facility for emergency operations. We don't expect problems because our emergency medical services is a very well-oiled machine and it can respond very swiftly, and we don't expect any further disasters beyond this caused by our own inefficiency.
Yeah, you've mentioned the maternity and pediatric wards in Xamlashe. Does that mean the rest of the institution is still functional?
The rest of the institution is functional, but again, as I said, the OHS teams are going to be in place to assess the broader impact of the damage. While the 2 wards are affected, the bigger precinct may not be safe for optimal utilization, though they're going to delineate this morning which areas should be declared non-functional, even if their roofs are still there. Because if it happens to rain or the wind continues, we don't want to expose our patients and the public and our workers to further danger. So we'll hear from the occupational health and safety teams who are on site as we speak doing assessment, whether the whole hospital should continue to function or not. But from where we are right now, other areas are not affected. The patients are in place and they're being taken care of.
Yeah. What is the instruction there to the staff that work at these particular wards, where you've already evacuated some of your patients?
Most of them are relocated to other areas within the hospital, but there's those who have got specialist skills, like in maternity and even in pediatrics. We are transporting those to the hospitals that assisted us in receiving the patients that could not be accommodated there. We will be transferring them daily to assist their colleagues in the receiving facilities.
Yeah, and the word to patients who rely on these institutions, I mean, we're focusing on Xamlashe, but to our understanding, there's 6 in total. What is the instruction then to some of those patients who might seek medical care there?
Our call center is live. If they have any concerns, we have a number that they call, and that number is available 24 hours a day to update them. But most of the facilities, especially the clinics, the damage happens in the precinct, the fences, the gates, and sometimes even the supporting your parking areas. Most of the buildings are not badly damaged, and they pose any danger to patients for continuing to use those facilities. So we're not that much concerned. As I say, the only area that really we think is the worst damage is the Xamlashe Hospital. Other facilities are expected to continue to work. We have mobile clinics that will be taken to those facilities where infrastructure is difficult to access until further assessments. We'll be deploying our mobile clinics to continue to offer services in those communities. So we don't expect a disruption to continuity of care for those patients.
All right. Do you have that hotline on hand, Doc?
I don't have it on hand. I don't want to give you a wrong number. And I feel embarrassed, but it's generally available. I will send it to you and for you to share with your listeners and viewers.
Yeah, at the very least for their benefit. Very lastly then, Doc, these issues around adverse weather conditions compound the many issues that exist in health generally across the country. I wonder how difficult it is for you to access communities, for instance, that have always been difficult to access because of poor terrain or, difficulties around the housing in those areas, the informal settlements, for example, like the one that we're showing. I can't imagine an ambulance, for instance, being able to access anyone in need of assistance in these kind of areas.
Yeah, we have that problem, but we're working very closely with our local municipalities through our intergovernmental relations unit to make sure we assist each other. Sometimes it's roads, sometimes it's criminal activities. There are a lot of things that really inhibit and prohibit access to those facilities. But even just the basic infrastructure. But the work that is done by local councillors there, it's amazing. I mean, they're using their own cars to get people to areas where ambulances can be able to pick them up. So there's a lot of mitigation that's being done there through local leadership in those areas. So we've not really had a problem. Even the criminal activities where our EMS personnel were being attacked, I'm sure you've seen or noticed a reduction. It's purely because of the activity of the local councillors and even traditional leaders in many of those areas. So we are getting assistance from other sister departments in order to make sure that we're able to reach out to those in distress.
All right, Dr. Mtandeki Xamlashe, thanks very much indeed for your time. Really do appreciate it. Dr. Xamlashe is the Deputy DG of the Health Department in the Eastern Cape.